You are watching McLaren Port here on today's health program, and I am speaking with urologist Dr. Haider Rahbar about conditions that affect men as they age. And in this segment, we're going to be talking about enlarged prostate. So, Dr. Rahbar, can you explain what is an enlarged prostate?
So one of the facts is as we age, our prostate starts growing in size, and it's under the influence of hormones. And there's also a thought process that's due to some of the metabolic diseases, diabetes and hypertension, that is causing the prostate to enlarge. And the issue is when the urine flows through, it flows from the bladder through the urethra, which is basically the opening in the tip of the penis where the urine comes out from. And as the prostate enlarges, it can cause blockage of urine from flowing through it smoothly.
Yeah, I believe we have an image that we can kind of show our viewers what we're referring to here. It might make it a little easier to.
So we have the bladder right over here. That's where the urine gets stored. And when we're ready to void, there's pressure within the bladder. The urine is going to flow from the bladder through a tube called the urethra. And right over here is the prostate. So you have the urethra right here, and the prostate surrounds the urethra and then continues to flow until it goes to the outside world. As we age, this organ, the prostate, increases in size. And one of the things is it grows outward, but the other thing, it also can grow inward. So once it starts growing inward, now the bladder has to generate a lot of force in order for the urine to come out. And on occasions, if the enlargement is severe enough, it might completely block the bladder from being able to void.
Right, and so in this example, this is a cross section, so the prostate is completely surrounds the urethra. So you
Correct.
could imagine when it's enlarged that it could constrict.
Absolutely.
You had mentioned some causes of an enlarged prostate. Are there additional ones that you wanted to mention?
So, I mean, the main factor, it's still a poorly understood process. It's believed to be under the influence of hormones, but there's now some studies and some theories that show that obesity, diabetes, hypertension, high cholesterol actually impact prostate growth, and they can be causing some of the BPH symptoms that are in men.
Yeah, and then probably age is just another as you age.
Absolutely. As we age, our prostate keeps growing in size, and the older you are, the bigger your prostate is.
What are some of the common symptoms that a man would experience if he has an enlarged prostate?
Usually, kind of symptoms you will get is a weak stream where you don't have the same stream that you used to. The other thing is you have to push to urinate because now the bladder has to generate more pressure to be able to urinate out. And then some other symptoms, some people can actually present with some overactive bladder symptoms as a cause of their prostate blockage. And the reason is since the bladder is working so hard to generate the urine, now there's an increase in the muscle of the bladder, which causes an abnormality within the bladder, and that can cause some of the overactive symptoms.
In our last segment, we did talk about the overactive bladder, and you had mentioned how important history of physical. So since some of these symptoms kind of overlap, if for lack of a better word, that could be probably really important then.
Absolutely.
Yeah. Are there other tools that you use to help diagnose?
So usually when a man presents to us with the complaints of a BPH, the first thing we do is a rectal exam to assess the prostate size and make sure there's no other abnormalities. We also obtain a good history and physical to make sure that we have covered all our bases. We obtain a urine sample to ensure there's no blood in the urine or any other abnormalities within the urine.
And what are some of the treatment options that are available?
So some of the treatment options include medical therapy, and the other option is surgical therapy. We usually start with medical therapy and see how people respond to that, and then if that fails or patients are having side effect from medical therapy, then we go to surgical therapy.
So there's medications then when you say medical therapy?
Correct.
So.
There's medications out there, and the way these medications work is there's two main classes that we use. One of them, it kind of causes a decrease in the prostate size, but that takes some time. It takes about 3 to 6 months to notice results. And the other one, if we can have the diagram back, and I can explain. The other one, what it causes is that it causes a relaxation in the urethra within the prostate, and that allow you to void easier than before.
And then what would be the surgical options then?
So the surgical options, you usually do a transurethral procedure where we go through the urethra and we resect the part of the prostate that is causing the blockage. And there's multiple techniques out there. We can use what we call a hot knife, and to cut the prostate. The other option is we can use laser, water vapor to kind of destroy the prostatic part that is causing the blockage. The advantage of these surgeries is there's no cuts, no incisions. They're minimally invasive.
Oh, very interesting. Well, this has been really good information for our audience, but we do need to take another short break, so we will continue this discussion when we return.